Hello, my name is Maria Villar, and I'll be presenting Botox My Brain, an analysis of the private and public healthcare systems in Brazil. Imagine yourself going on a trip to Brazil. The flight is amazing, the water is clearer than any other you've seen. It's unbelievable. You get to Rio de Janeiro, a place where everything is right there, a city embedded with culture, history, and people. All sorts of people. Rio is home to one of the greatest Latin American TV channels, as well as the beautiful beaches of Ipanema and Copacabana. Chilling at the Ipanema beach between the perfect lives and the tall, tan, young and lovely bodies, something different catches your attention. Some poor-looking kids strive to sell all sorts of products, from cheese to sunglasses. You immediately start wondering about these kids' lives. Unfortunately, Brazil is the country of disparities. The scenario is institutionalized and is said by the medical school professors Dallagnol et al. The severe social inequality is characterized not only by income, color, race, and sex, but also in terms of access to employment, workplace, and housing. In this context, the severe economic and political crises that afflict the Brazilian picture affect directly the universal health care policies as well as the social protection policies that cause consequences to health outcomes, creating health inequalities as stated by the research made by Harvard University's researchers Masuda et al. In 2018. For instance, I would like to introduce you to Joanna and Teresa. Growing up, Joanna lived in San Cristóbal, a favela in Salvador, a city in the northeast. Favelas are defined by the Informal Dictionary in a free translation as a place that has all the aspects of a community, but the clear aspect of the social and financial difficulty is predominant. Teresa, on the other hand, was raised in a noble residential area in Salvador called Nazaré. Though living in the same city, they share an abyss between their stories. Joanna was the oldest of 5 kids. She was raised by her mom alone, and by the time she turned 11, she quit school. The former fifth grader with low qualifications had to start to work as a full-time babysitter so she could help her mom financially. Teresa's life was different. She and her 2 siblings were raised by both parents, went to good schools, and graduated high school as one of the top students in their class, and only started to work afterwards in high-paying jobs. We can see that what the Latino Coalition for a Healthy California defined as economic justice and educational equity do not apply to these different backgrounds. In a free analysis, the right implementation of these guarantee that, given the social and financial differences, all individuals have educational and job opportunities that fit their needs. Joanna and Teresa's social insertion remained stagnant. Their income during the years was shaped by their parents' social status, and a disparity that is observed by DAS to be harmful to the access to healthcare. While Teresa privately took the steps to put silicone implants in her breasts and have an upper lip reduction, this rated by the International Society of Aesthetic Plastic Surgery as the second and third most common plastic surgeries in Brazil, Joanna didn't have the same privileges. In Brazil, Joanna's situation is the most common, with more than 70% of its population not privately insured. They rely on the free public unified health system, SUS, as their source of basic primary health realization alone. The SUS, implemented as one of the parts of the sanitary reform movement, has been known worldwide and in Latin America as a successful step to Brazilian re-democratization after the dictatorship that took place between 1964 and 1985. However, Masuda et al. Explain that the structure has some weaknesses and is shown to have clear disparities in its axis. In December of 2013, Joanna weighed 88 pounds, a consequence of the precarious access to decent nutrition and vitamins, and lived in this situation. Back then, she started to feel like something was wrong. She was uncomfortable going to sleep and coughing a lot. Then she considered visiting one of the nearest hospitals or emergency clinics, but the long queues made her just give up. 3 days later, she was unable to stand up and move without assistance. Given the hospital visit was imminent, she had her mom take her through crowded public transportation to the hospital. After waiting in line for over a day, she was admitted and diagnosed with the highest level of tuberculosis. The doctors then immediately prescribed that the people from the place Joanna works at were tested for the disease, and I was one of these people. So while I was walking in the hospital, they knew I wasn't carrying the disease because I looked well fed and nutritionally stable. For 6 months, Joanna's treatment consisted in medicine doses given by the SUS, but there was not even a subsidy for her nutrition or housing to better. Differently, in 2008, Teresa also felt that something was wrong. After utilizing the private services quickly and with enough quality, she was diagnosed with lupus, an autoimmune disease that makes the body attack healthy tissue. Her journey through diagnosis costed her over $3,000, and it's maintained monthly with over $2,000 in medicine and doctor's appointments. This health price tag is not affordable for all. And the statistics shown by Antonio Regalado, senior editor for biomedicine for MIT Technology Review, in his 2013 study, these expenditures between the ages of 25 and 65 just rise exponentially and can reach an average of $10,000 per year. In this context, it's left for us to understand why people like Teresa can rely on SUS as their first source of health. This is explained by the fact that the service, though is affordable, fails in some way the four essential elements for health promotion defined in 2018 by Cangusu will tell you at all that are availability, accessibility, acceptability, and quality. The system has gaps that can cause the users to lose their lives because of functional care, shortages, and late care. The doctors and researchers nowadays don't focus on providing all with better health because it's not as lucrative as some of their technologies when applied to fields related to plastic surgeries and other aesthetics procedures, as acknowledged by Matka et al. How can I help? The change of mentality from healthcare providers focusing on effective health realization has to be the first step to make people like Joanna more covered. Though the idea that healthcare system has to be changed is great, it's not tangible by non-governmental individuals. Influenced by this reality, NGOs like CARE work to provide resilience with youth empowerment, girls' education, raise awareness for child poverty, and support the microfinance. Another NGO that works on implementing food as one of the core elements to PHC is Banco de Alimentos, Food Bank, and a free translation. They work looking forward to bringing educational and prophylactic actions to the existed communities, reduce hunger and combat food waste, and expand actions and knowledge outside the areas where there's hunger. In addition to that, a Latin American NGO called Teto in Brazil has a vision of creating a fair society that is equitable, integrated, and without poverty, where people can fully exert their rights and duties and have opportunities to develop their capacities. Their implementation is through building emergency housing, renovating recreation areas, and promoting workshops for rights education. The work of these three organizations together help mitigate the fact that the Brazilian healthcare system is flawed and try to acknowledge health realization as a resultant of several different levels. And I believe that indirectly, the whole picture can be changed with our help. Thank you.